Community Analysis Presentation of Southeast Washington, D.C. Presented by Shanika Miles, Nurse 4636, St. Petersburg College. Anacostia, a historic district of southeast Washington, D.C., was once occupied by the Natchitoches Tank Indians, who gave the area its name Anacostia. Southeast Washington, D.C. was a suburb that housed military and manufacturing sites. The area was known for its low-income housing, making it an affordable area for residents to live. In the 1960s, the area became poor, overcrowded, and lacked services to the community. Drugs plagued the area as well. Not much has changed in the southeast end of Washington, D.C. since the 1960s. The area is still overcrowded, plagued by drugs, and offers low-income housing. The area does currently offer a lot of community services, but like many low-income programs, many of them have long waiting lists. Contractors are looking into building southeast Washington, D.C., leaving many residents concerned about the historic character of the district being maintained and the affordability of housing. Many of the other areas in D.C. have experienced these changes, and many of the African American population have been forced to move outside of the district due to these high-priced housing. This has in turn caused overcrowding and high crime rates in many of the Maryland suburbs. The structure of Southeast D.C. and other areas are not much different. Southeast D.C. has a council member who oversees the everyday running of Southeast D.C. The council member is an advocate for the community and the people. She also presents the need for the budget and where to allocate the monies. In surrounding areas, they have a mayor and a governor. The district has a mayor and a council member. The district relies heavily on government funding and is taxed without representation in Congress. The District of Columbia is not a state, and the everyday running of the area is noticeable. The government has a heavy influence in the District of Columbia that may not be seen in surrounding areas. Southeast D.C. offers a lot of apartment-style living, while other areas have a variety of housing styles, such as single-family homes, townhomes, apartments, and mobile homes. One issue the District of Columbia has as far as its structure is communication. Many programs have long waiting lists and do not communicate with one another. The way of solving problem is to develop a new program or paperwork, but never to solve the problem or appoint an organization or person to oversee the everyday running of the community programs. Southeast Washington, D.C. does not have a diverse population living in the area. The population is 93.5% African American. The majority of residents are 30 years old or younger. 36% of the population lives in poverty. Surrounding areas see a more diverse population, and the majority of residents are in their 40s to 50s. Local areas do not have a large population in poverty. The majority of the citizens are middle class. The leading health concerns in Southeast D.C. are heart disease, cancer, HIV, and homicide. The leading health concerns in the United States are heart disease, cancer, chronic lower respiratory disease, accidents, stroke, Alzheimer's disease, and diabetes. Other populations' health concerns are in comparison with the same health concerns as Southeast Washington, D.C. The difference is HIV and homicide are of a concern in the District of Columbia, but not of major concern in other communities. Residents of the district have easy access to resources as far as transportation is concerned. Many programs have long waiting lists and are not open for new clients. Local providers may not accept Medicaid or HMO plans. This can be a problem for low-income residents, making them seek treatment further from home or not at all. The programs are geared towards combating poverty and mental health issues in the District of Columbia. Many of the services are of no cost to the residents, or fees are discounted based on income. Southeast D.C. has an adequate amount of providers, but are limited in the amount of providers that offer services to individuals with Medicaid and underserved population. Ward 8 has the highest obesity rates in the District of Columbia. The issue must be addressed. The District of Columbia had 835 newly diagnosed individuals with HIV. 207 individuals die annually from HIV/AIDS, and 14,465 individuals are currently living in the District of Columbia with HIV. The District of Columbia offers recreation centers, community centers, and public parks for residents to utilize for recreational purposes. DC offers a public water supply with water treatment services. The air quality in DC is in the green range for good quality. DC offers rodent control to combat the pest issues in DC. DC offers several means of public transportation for residents to move freely among the area. The District of Columbia offers several community meetings and welcomes residents to attend the meetings. The Ward 8 budget allocated a lot of funds for transportation and a smaller amount for public safety, affordable housing, and education. The government has great influence in the District of Columbia, controlling local funding and community program budgets. A main political concern that has been a factor in the District of Columbia is the fact that the citizens are taxed but have no representation in Congress or the House. The first need addressed is the need to prevent and reduce disease and disorder. The district has a high prevalence of heart disease, cancer, HIV, hypertension, and diabetes. 88% of the residents of Southeast DC have medical coverage that consists of Medicaid and HMOs. Although many of the residents have medical insurance, many healthcare providers do not accept Medicaid or are not in network with the HMO plans. Southeast DC has a high crime rate that must be addressed in order to keep residents safe. The District of Columbia has the third largest poverty rate in the U.S. This issue must be a top priority for DC. DC must promote healthy eating habits and social habits in their residents to promote good health. The mortality and life expectancy rate must be addressed. By promoting healthy eating and health behaviors, this issue can be tackled. The leading causes of death in the District of Columbia must be addressed by first promoting prevention methods and preventing exacerbations of the current disease. Promoting maintenance of the diseases can eliminate the amount of ER visits for chronic ailments. The leading causes of death in DC are as follows: heart disease, cancer, HIV, hypertension, and diabetes.